Okay, Ellie, thank you. So I've seen round 3 of the lodges and the main house. It is phenomenal. I mean, I'm completely blown away. What would be great is if you could almost start from the beginning, not with the tour all over again.
Good.
No. I would train half an hour, but just about the sort of concept of Harrison House, because you've set it up from scratch. You had to find the site, had to design everything, but bring the staff team over with you. So I don't know if you could just
in a nutshell.
Yeah.
In a big nutshell, we were camping in wards on a general hospital site that were completely unfit for purpose. You visited. There were squash. There were run down. They were really not built for mental health use. So Kevin Bond secured funding of £14 million, and that was to buy the land and to actually open up fully running. So we had £14 million. Alongside looking for land and finding the right place, we also decided to develop the service. I think nationally crisis teams aren't working anymore. I think the people that you talk to across the services, crisis teams have passed the sell-by dates. So looking at what Waverley and Norfolk had done, or Norfolk and Waverley, and I think somewhere down south has done it as well, and it comes from NICE guidelines. We decided that we would actually integrate crisis and home treatment into the units. So we disbanded crisis team. We went through a long consultation process, disbanded crisis team, lots of protests from staff who felt that they'd been on the wards, basically they'd done the time and they'd moved on, they didn't want to come back. So some staff voted with their feet and left us, and some staff came along with reservations and trepidation but joined us. So we then had to get the crisis staff back used to working on the units, and then we had to teach inpatient staff how to actually do home treatment and to do crisis assessments. So as well as doing all of that, we then decided that we found the right piece of land and that would actually build on this site. So for a year of madness, basically, we disbanded our crisis team. We brought them onto the units, and we also worked on this project to develop this piece of land. So it's been a very busy year, but we cracked it. I say we lost some staff along the way, but most of the staff are really, really enthused, not just by doing different types of work, but also from coming to work on a new site. It's completely fit for purpose. It's hotel standard. The staffing levels are one of the highest staffing levels in the country.
Oh, really?
So we've maintained that as well.
That's brilliant.
So as well as having 2 10-bedded units and a 6-bedded enhanced care unit that we would open and close as we need it, there's generally 5 staff allocated to work on the units, as well as crisis and home treatment.
Right.
And 4 staff on each unit at night time, including a crisis worker.
Wow.
So it's really high staffing level.
Wow. 4 staff on at night for 10 for 10 patients in each unit. That is amazing. And something I hadn't twigged before was you were saying that that the enhanced care unit is only open if it's needed. So there's 2 patients in there at the moment, but if they're
closing down this afternoon, one patient's already come across to this unit. Because the consultant-led units, so we have a consultant for each unit, depending on GP locality. So one patient's come back here, and the other patient's been assessed now to go back onto his unit. So that will close down. Staff will come back. And
That's amazing.
What we do on every single day, we allocate people to open that unit. So should we open it tomorrow morning, there will be staff identified to go into that unit, so we're not scrabbling around for staff, because one of the biggest fears was we open a unit and we don't have enough staff for it.
Yes.
So the staff allocated, it doesn't mean that those identified staff will go in, but it means you've got the flexibility to look at who works best with that patient, who knows that patient, who's worked with them before. So staff on this unit might go over to Pelham, and Pelham staff might go over to Brocklesby, because they know the patient best. So there's always enough staff to open that unit, but the identified staff might not be in that unit. So it gives enough flexibility.
This is...
We really thought outside the box.
God, you really did, and it is so extraordinary. And partly it's extraordinary because it makes so much sense, because if I've got this right, so on any given day it might be that that the 2 admission wards obviously are still sort of going, and the enhanced care unit, has up to 6 patients.
6 beds.
Has up to 6 beds, and so let's say there are 6 patients there, but it might be that unit, that the enhanced care unit doesn't have any patients, so the staff are over here adding to the quality here, but also with the flexibility that actually if you don't need that many staff here, the same staff can go into the community and either work on crisis or on home treatment, to actually do proactive work with patients.
From band 3s up, go out and do home treatment, including myself. So I've had to learn, because I've never done crisis assessments before.
Oh, right.
So I've learned that role. So I do crisis assessments now, because 60% of my time and my service leads times, who are band 7s, is clinical work.
Wow.
So 40% paperwork, extra mess, and 60% is clinical work. So I do crisis assessments, home treatment, as well as running a shift.
And that's really amazing, because you're doing, and you've been trained to do what your staff are doing and have been trained to do. So yeah. So you've been doing the training alongside them.
My boss, Mike Reeve, it's the same. He's 60% clinical, because his passion is service users.
Really?
So from Mike Reeve is the overall acute manager, and then myself and Amanda are below Mike. So our passion is working with service users, so that's what we do.
So 60% of you senior managers' time, so that's very bad English, and myself, is spent on clinical work.
So
that's fantastic.
Mike's an 8B, Amanda and I are 8As, and then we've got 4 band 7s.
That is just really impressive, and the whole sort of holistic and coordinated and service user centred approach is really, it's just outstanding, and it just goes on, because then there's tukes running all these services, so a service service run by service user staff are doing so much of the support work you described.
All the auxiliary work.
All the auxiliary work, the gardening, the catering, the concierge. It is
the allotment in the corner in the greenhouse that went up yesterday, linking in with the YMCA next door and using their land for an allotment. So we're going to produce vegetables for both of us. We've even joined the neighbourhood watch with the hospices and the fire brigade and the private hospital and the YMCA.
It is just phenomenal.